Thank you for joining us this afternoon on the program Health Living. I'm Adesu Wawusawage. What do you know about lupus? Is it strange to you? Are you hearing that word for the first time? All you need to know about lupus is what we're going to be looking at today. And I have with me Dr. Onose Onwalu. She's a senior registrar, Rheumatology Department from the University of Benin Teaching Hospital. Happy to have you join us today. And that smile.
Thank you so much, Adeso. It's a pleasure meeting you finally in person.
Okay, finally, we're here together.
Well done. Keep up the good work, ma.
Thank you, thank you. So, you know, when we spoke offline, I was like, what is lupus? I had to go and do my own little research. So, for the purpose of that person who's watching for the first time who doesn't know what lupus is, please tell us, what is this all about?
All right. Thank you so much, Adeso, for having me. So, the month of May is our Lupus Awareness Month, and lupus is a shortened form for an autoimmune disease.
Autoimmune disease.
I'm actually going to be doing a lot of explanation
right
please
now. Please do. Let me just relax and then listen to all the explanation.
Thank you so much, ma. So, when we say auto means self. And when you say immune, it means the immune cells. That's the immunity of a human being. Now, the way man was created by God or Jehovah or Allah, anyone that you believe in, God made immunity, your immunity. Your immunity is to protect you from infections and diseases. But apparently, people who have autoimmune disease, the immune cells that are supposed to protect them from diseases is not fighting themselves. Okay. So that's why you see auto self-immunity. So your immune cells are fighting you. Now, when we hear it, the first thing that comes to mind is a spiritual attack. Okay. But for the rheumatologists, who are these are doctors that specialize in autoimmune and musculoskeletal disorders, what we want to tell the public and everyone that autoimmune disease, they exist, and even though they exist, they are not spiritual attack.
They are not.
It's a disease just like we have hypertension or diabetes. So now coming down to lupus. Lupus is an abbreviation of a disease called systemic lupus erythematosus. Okay. So what that means is that the immune cells is attacking the human body, and it now affects the whole system. And the system comprises of all the organs in the body. So the origin of this illness is autoimmune. So the immune self is attacking itself.
Why
There's
so?
like a misnomer. Yes, I was about going to that. Thank you very much for your question. There's an abnormal signal in the body. Because, for instance, if I'm to have a cold now, before the cold weighs me down and makes me lie on the bed and I'm not able to walk, my immune cells become active. So you find out that some of us will just have catarrh. You don't even take any medication, and the catarrh just goes away because your immune cells are at work. They are killing those infections before they weigh you down. So we say that there is an internal signal that gives the sign to the immune cells for them to start working. But for people who have autoimmune disease, that signal is distorted. These immune cells, they just erupt out without any control. And because the immune cells have been programmed to kill diseases, so anything they see, they kill it, and which includes the normal human cells. So you see people that have autoimmune disease, they just become suddenly ill, and they are always ill because the immune cells are attacking their body organs without control. So SLE, lupus, also known as systemic lupus erythematosus, is an autoimmune disease that is multisystemic, meaning it affects all the organs in the body. And the cause of this is largely unknown. Scientists all over the world, they have tried to enact a cause for lupus, but it has not proved successful because there's no one cause that can be pinpointed as the cause of lupus. What they just have is risk factors. One of the risk factors is that it's genetic. If there's a family history of an autoimmune disease, it means that the child that is born to the mother or the father may have it in future. Also talk about environmental factors like exposure to petroleum, petrochemicals, exposure to pesticides, exposure to the ultraviolet rays of the sunlight, and even some form of viruses like Epstein-Barr virus. So all these are risk factors, but there's no one single cause that has been said to be the cause.
It's so sad to know that there's no cause. You can't say, okay, this is the cause, let me avoid it, or that is the cause, let me avoid it. And you know that in this part of the world, we always want to know. We always want to know why we're having one problem or the other medically. But this one that there's no known cause except risk factor is so huge to swallow.
Well, it's huge to swallow, but my joy is that we still have survivors of lupus. We have some prominent artists like Seal.
Okay.
Seal that's the singer that sang the Kiss from the Rose. He has lupus, and he's a survivor. And we have a whole lot of people too who have had lupus in the past.
Okay, so,
and they are able to
how do we know? What are the signs? What are the symptoms? Since
now,
we don't have a cause.
Yes, ma'am. Thank you so much for the question. At this junction, I would like to commend the works of the doyen of rheumatology in Nigeria and West Africa, Professor Adilowo, who single-handedly, by the help of God, has trained over 60 rheumatologists in Nigeria.
Wow.
He came in when there was it was not heard of in Nigeria, and he had to go overseas to the UK to train, and he came back to invest into this country. A lot of our girls were dying before now, but I thank God for the knowledge which has been propagated. So how you know is, first and foremost, lupus has a predilection for young girls.
Really?
Prof always calls them fair and pretty. They are always pretty and fair. But it just happens to have a predilection for young girls. And over time, it has been seen that a lot of girls are involved. And so there's this speculation that maybe hormonal interplay at the peak of reproductive age between 15 and 25 years can maybe maybe a risk factor for lupus. And it's also been found that even women, after pregnancy, they begin to have symptoms of lupus. So the number one symptom that you see is that you begin to have fever. The patient begins to have fever. You treat malaria and typhoid. You treat it like almost every month, and you don't feel better. You feel better a week, and you are down again. Then you see that they begin to have joint pains, multiple joint pains. Their fingers are swollen. Their wrists are swollen. They can't even hold their sponge. They can't even hold their spoon to feed themselves. And then you begin to lose a lot of weight. Their hair begins to fall off. Some of them, they come in with skin affectation. Yes, the whole system. They have skin lesions on their face. And you know, we ladies, we don't play with our skin, especially at that age group. Yeah, and lupus can affect any age. It can even affect babies. It can affect children. It can affect adults. It can even affect the elderly. Recently, we begin to see lupus affecting age group of 50, 60 years and all that. So the key symptoms that they have: fever, weight loss, multiple joint pains, multiple joint swelling and stiffness. And for some of them, because of the fact that the illness, you know, it's just becoming more known. I would say it has always been there, but doctors have just begun to notice them. So some of them come to us late. Okay. They come to us late, and then
perhaps because they don't know what is happening.
Exactly, yes.
They've been treating malaria. They've moved, you know, in this part of the world, we'll move from one spiritualist to the other. Because looking at it, since there's no cause, you would think it's spiritual.
Yes, ma. A lot of our girls have gone to pastors, prayer homes. Some of them have been tamed to be Ogbanje, Ibukun. They have been beaten, battered, because they feel they came to trouble their parents. But I thank God for the rheumatologists there that, yes, and unfortunately for us, the specialists were not so many in the country. Yeah, we're not so we're not that so wide. Like in Benin, I think I have two consultants. Then me, I'm a senior registrar in training. Then we have all over around Nigeria, but we are few. So you see that, but the beauty of it now is that, because it is now becoming well recognized, the doctors, especially the general physicians, they now easily refer. So once they see a young girl of reproductive age having these recurrent symptoms and appears not to be getting any better, you see that they begin to refer. They say this must be an autoimmune disease, and immediately they just refer to the rheumatologist. And unfortunately, because of the late presentation to the rheumatologist, you see that some of our girls, they come down with organ involvement. Okay. You see some of them come down with kidney failure already by the time they get to us. And it's quite disheartening telling a girl of 25 years old that you're going to be on dialysis or that you will need a new kidney. It's really painful. So that is why this issue is very important in our hearts. We're trying to spread the news that, please, any young person or anybody who is ill and you have done series of tests and treatments and they appear not to be getting better, please refer to the rheumatologist closest to you, because it could just be an autoimmune disease. Don't keep them with you, so that we can salvage their organs. Okay. Because lupus has a predilection for the kidneys and the brain, and we don't want them to start acting psychotic or having as though they have psychiatric illnesses. So it would be nice for us to pick them, even we individuals, neighbors, as many as are hooked onto ITV right now and you are listening to me. If you have anyone around you with this kind of illness, please refer to the rheumatologist in UBTH.
Now, you did say that young girls are usually the victims.
Yes,
what about the young boys?
Yes, thank you so much.
Are they spared from all of this? Why
Thank
should
you
it
so
be a
much.
female thing?
Yes, thank you so much for your very intelligent and insightful question. Actually, what has been seen from series of studies and even from my own personal experience with patients is that there's this will I call it like a risk factor that has just been recently propagated, that the hormonal interplay in the females has been seen to be a very, very significant risk factor in getting lupus.
Okay.
We discovered that a lot of young women at that reproductive age, they come down with it, and then even some, when they just finished having their babies at the peak of hormonal surge.
Go ahead, please. Yeah.
At the peak of hormonal surge, you see that they also have these features of lupus. So that is why I would say it's more common in females, and other risk factors that have been listed. The ratio, according to the books, is between 9:1. For every 9 female that has lupus, we just have 1 male. So somehow it happens to be uncommon in males, but the sad thing about this is that for the males that are affected, when it comes, they come in very critically ill, and most of them don't survive it.
Most of the males don't survive.
Yes, ma'am.
That's very, very sad.
Yes, ma'am.
All right, looking at this issue, I realized that we have more than 100,000 cases per year.
Yes.
And now you just mentioned that we have few specialists in that area.
Yes.
So what happens to all of these persons?
Well,
Are we just going to lose them? 100,000 per year in Nigeria. We're in Edo. Let's take Edo, for instance. How many specialists do we have in this field?
Well, I thank you so much for your question. It's one of the challenges we are having in this subspecialty, because it's a rare subspecialty. It's because the autoimmune illnesses, they appear to be uncommon, and the subspecialty appears to be new, so to speak, in Nigeria. So people don't really come to rheumatology because they feel it's not a thriving area, but we discover that our patients are very ill. If your one patient can keep you on your toes for all night, you can't sleep, you have to be by their side, and even the medications for treatment is quite expensive, and so you have to stay by the patient to ensure that they are not reacting. So what I would just say is that we try our best to reach out to the general populace as much as we can. For instance, all over the country, we have 5 rheumatologists in Lagos. In Benin, we have 2 consultants and 1 senior registrar. In Asaba, we have 1. In Nnewi, we have 1. In Owerri, we have 2. In Maiduguri, we have 1. In Sokoto, we have 1.
That means we don't have up to 100 in Nigeria.
No, in Jos, we have 2. Currently now, especially with the Japa syndrome of medical doctors.
Yes.
As at, I know when we counted, the Nigerian Society of Rheumatologists, we have a total of about 60 rheumatologists. But right now, those present in the country, 60. Those who are available right now, they're just about 30.
Those who are available right now are just about 30.
Yes, ma'am.
And every year we have like 100,000, not 10,000.
In our rheumatology clinic alone,
cases per year.
Yes, we have a lot of them. And the good thing is that doctors are recognizing, so they are referring, but the ratio of the patients to the doctor is very, very few. The gap is wide. Gap is wide. Well, we try our best to reach as much as we can. We have people who travel all the way from Agbo, Saple, Warri, to come and attend our clinic at University of Benin Teaching Hospital. And everybody wants to live.
Okay, is it self-diagnosed, or how do we diagnose it?
Okay, thank you so much. Unfortunately, the laboratory,
because we are used to self-medication in this country, so that when you're self-medicating, you know what you're doing for yourself. For
autoimmune disease, you can't self-medicate, especially for lupus. Lupus comes in different ways and in different symptoms. Sometimes we have patients that don't have joint pains, they don't have hair loss. What they just have is fluid in their lungs. And by the time you do a history, you take history from them, you say this patient has lupus. And the beauty of it is that the way we were trained to rely on clinical symptoms.
Okay.
We were not trained to wait for lab, because our investigations are not done here in Nigeria. They have to be sent to Germany or Turkey.
Not done here?
Yes, we use the same lab.
It's a serious case then?
Yes, ma'am. We use the same lab. The reagents that are being used for this test, they are quite expensive, and because the turnover We don't have such a plethora of patients like hypertension, hypertensive patients, diabetic patients, and of course this lab they need to make their profits. So because of that, these reagents are only sought out overseas, Germany or Turkey. So they send their blood samples over there.
If the patient does not have that much money, that patient might just die.
Oh yes, beautiful. So what Prof has done, Professor Adelowo, and I use this opportunity to tell him a very big thank you for his thorough training. He trained us more on clinical symptoms. He came from the UK, they have their standard, but coming in here to very poor resource countries where patients cannot afford tests, a routine test, a diagnostic test in SynLab is 40,000. Now imagine an average person affording 40,000 before you do the other tests and before you start buying drugs. So what he did was that he trained us on more of clinical symptoms. So when you come, you are collected, you are examined, and then we have an European criteria for diagnosing lupus. So once we fit into a certain level in that criteria, we start treatment, because it takes us 2 weeks for us to get a report from Germany or Turkey on your results. And if we wait for a result for 2 weeks, that patient is gone.
What if you're treating a patient and when the result comes back, you discover that lupus is not what is happening to that patient? What do you do?
90% of the time, no, 99% of the times we are right. You know that these patients have gone round. If you hear them say, I went to like 4 or 5 hospitals before they now finally told us that they think it is autoimmune, go to UBTH. So already, by the time you have a history of frequent treatment, frequent hospital consultations without the patient getting better, because the rule is that having met criteria A, B, C, D, and ruling other causes is autoimmune.
Wow.
Thank you, ma'am.
Okay, let's look at this. Let's look at treatment. Because you just said that this disease destroys, it affects all parts of the body.
Yes, ma'am.
Every part of the body.
Yes, ma'am.
Then how is treatment like? Maybe somebody comes down with some kind of problems in the head, or you have swollen hands, or have swollen legs. You know, how do you treat that person?
Yes, thank you so much.
Do you use one drug to treat everything? You know,
like
you go to some places, they tell you use this drug to treat everything. No. You know, how do you treat?
Okay, so what happens is that we look for the dominant organ involvement when the patient comes.
Okay.
We have some girls that come in quite early. So what they just have is the joint swelling and joints. So our first line of management is to bring down the swelling. Because what lupus does is it causes a widespread swelling. So you have swelling of your joints, you have swelling of the what we call pericardium. Pericardium is a sac around the heart. So you have swelling of the brain, the kidneys. So what the first line treatment is to bring down the inflammation and to bring down the antibodies or the immune cells that are attacking your organs. So we have a first line drug. So once we do that, then we now begin to look at the organ that is predominantly involved. And those organs have their specific treatments. And we also have what we call a multidisciplinary approach. We have sister subspecialty that join us in treating our patients, especially the skin. Our girls are very conscious of their skin, so we can manage with the skin doctors. Some of them come with complete hair loss or partial hair loss. We also discuss with them. So you bring in different doctors? So we bring in different doctors and we all work together. But our own area there as rheumatologists to ensure that the disease activity means that the lupus level is very high, is to bring it to the barest minimum. Because once the lupus activity is brought to the barest minimum, other subspecialties can now come in. So we bring down the lupus activity and then we can now invite our sister subspecialties to support in the management of these patients.
You know, when it comes to illness, it's quite cheering when you tell somebody that don't worry, you'll get cured soon. You know, when you go to at least I've been on hospital bed when doctors will come, oh, don't worry, you'll be fine soon, you go home soon. Now, is this, can we say this of somebody who is down with lupus?
Yes.
Is it curable? That is just what I want to know.
Lupus is not curable, but it is manageable. Not. Yes, it's manageable. So that's why what we do now is to involve our patients in treatment. We talk about it all the time. We have a WhatsApp group, we discuss. We keep talking, training and retraining, because we discover that when we involve patients in their treatment, we get better returns. Okay, it's like somebody is trying to call me. Okay, let's see how many calls we can take before we wrap up, because I have just 4 minutes more. I'm hoping that I'll be able to like talk, because this topic is quite interesting, and hopefully you'll be with me on radio on Thursday so that we can talk further. Hello, caller, are you there? Hello? Okay, good afternoon. Talk to me.
Yeah. I'm calling from Igota. My name is Ubo Christopher.
Okay, go ahead with your question, please.
I want to know if it is sexually transmitted.
Okay, if it's sexually transmitted.
Okay, no, please.
Okay.
Lupus is not sexually transmitted, but it could affect sexual function. That's a topic for another day.
Okay. All right, so you hear that, my brother. It is not sexually transmitted, but it can affect performance in the other room. All right, the phone number is right there on your screen. Let's see if you can do 1 or 2 more calls, because I want you guys to call in. You know, this topic today is very touching, honestly, because I'm just trying to imagine those who are down with this disease and how they are faring, how they are keeping up, knowing fully well that this disease cannot be cured, particularly young girls. It's sad. You know, sometimes women give birth, and after a while, the person starts behaving abnormal, and then they'll say, oh, they don't shoot them, they don't get them, you know, that kind of a thing. It might just be lupus without that person knowing. And our attitude to assessing medical care is very poor. All right, so use the number on your screen and give us a call. Hello, caller. Hello? Okay, I think we lost that call, and it's sad to know that the disease is not curable, it's just manageable. So for how long? What is the expectancy rate, like the life expectancy rate, when you have to treat somebody? Is treatment every day?
Yes, so we'll come to that
treatment
now.
Is every day?
Yes, actually.
So you have to take drugs every day?
For the rest of their life. And what we do is we do try and work on their psychology, because any illness that you are able to win psychologically.
Okay, let's do this call. Hello, caller.
Hello.
Please reduce the audio level on your TV set, please.
Okay, ma.
Okay.
Good afternoon.
Good afternoon. The audio level on your TV is too loud, so I will not be able to hear you properly. Hello? Okay, doctor, let's continue. I may just have to let this caller go. When you're calling, reduce the audio level on your television set or move away completely from where your TV is, so that you can see that I'm almost losing my voice already, because I'm so pained. I'm so pained. Okay.
So for treatment of lupus is for life. So what we'll do first is psychological. In short, our consulting room is a place for tears. We sometimes we even cry with our patients, having to break the news that you have lupus. We've seen boyfriends walk out on their girlfriends, or we've seen fiancés walk out on their fiancés because they feel, I can't deal. So it's actually a lifelong supportive illness. You have to support family. We need a lot of support, family support. If it's spousal support, we need spousal support. So that's the first thing. That's that tender, loving care of the family, and of course financial support. You need to buy your drugs. The drug can be quite expensive, especially our girls who have that kidney involvement. They have to be on hemodialysis twice or thrice a week, and some of them even need to get a transplant. So it's something that's actually financially draining. But one thing I have realized in our patients is that once you are able to follow up the illness back to back for the first 5 years, you are able to understand your body, because lupus will always give you signs. There are triggers of flare. We have what we call flares and remission. Flares means that the lupus activity is quite high. Remission means that the disease is quiescent. So there are things you must not do, like excessive stress, physical stress. Okay,
please tell us what
emotional stress
we must not do in the next 1 minute.
Okay,
things
so
we must not
number one,
do.
don't go beyond your boundaries. A woman, a married woman who has lupus, you don't go to the market, you don't cook, you don't wash on the same day. You stagger your domestic activities, and you must have a domestic assistant. It's very, very important. Emotionally, try your best to emotionally stay, because even emotional stressors can trigger your illness. And if you must get pregnant, please get family planning, because the period of pregnancy is a sensitive period. Pregnancy can induce a flare of lupus. Of course, you must take your drugs. They are lifelong. Your immune cells need to be suppressed. So you are going to be on immunosuppressants for life. You must keep good, healthy living habits, because your immune cells are suppressed. So you have to try to improve it by your lifestyle, which includes good food, and of course fruits and vegetables. You shouldn't be involved or seen taking alcohol and herbs. Some of these herbs interact with your medications and reduce the effectivity of your medications. So these are the basic things that you should, and of course avoid the ultraviolet rays of the sun. It is very important that all lupus patients, you must have your caps, you must have your long sleeves, and you must have your sunscreen, because even the rays from the sunlight can trigger lupus. Basically, try and take enough rest as much as you can, and exercise. One of the challenges we have with our lupus patients is that they complain of fatigue. Doctor, I am always tired. So we encourage them to do as much as they can. If you can't walk for long, you have your skipping ropes. Always make sure you try to do your skipping jumps as often as you can. So with this basic lifestyle and of course taking your drugs religiously and having a good mental health, after all, we all need good mental health.
We need good
We all
mental
need
health,
good mental
particularly
health.
women.
You are going to win lupus. That, and of course with whatever you believe in, whatever faith you believe in,
Okay.
believe in God, you believe in Allah or Jehovah, you put your trust in,
Dr.
and you'll be
Honestly,
fine.
I wish we could go on and on and on, but time,
you.
of course, is not our friend. So we're going to end it here today with the hope that Thursday, 3:15 p.m. on radio, 92.3 FM, you will be with us and you'll be able to continue with this conversation. It's quite interesting, and I'm hoping that we're going to do a part 2 after this.
Thank you,
so
my
thank
pleasure.
you for finding time to
Thank
be
you,
with us
my
today
pleasure,
on the
ma.
program.
Thank you so
For educating me and so many other persons out
Thank you
there.
so much.
When you see all of these signs and symptoms, please, it is not juju, run to the hospital. We'll see you again. Bye-bye.